common sickness that people experience almost all the time. Sometimes you don't eat and then the little noise you hear in your tummy, you're like, am I getting ulcer? What is ulcer? And then what have you, the causes, what brings it, and some of the treatments, and then what have you is what we will be discussing here on the show this morning. And our guest is none other than Mrs. Edna. Yes, you remember her, right? When just last month, when we're discussing Pink October, celebrating Pink October, discussing breast cancer and what have you, she was our guest. And this one, she said, okay, October is over, but I'm not going to leave your viewers hanging. Why don't we discuss ulcer? And she's here this morning with us. Good morning.
Good morning.
How are you doing?
I'm well. How are you?
I'm doing well. Good to see you.
Good to see you.
You're always looking nice.
Like your films.
Okay. Thank you so much. How has it been, especially after the whole breast cancer celebration and what have you?
Well, people are still in the breast cancer mode.
Okay.
People are asking more about breast cancer.
Right.
I think the awareness went well.
Okay.
We are hoping that it gets better as the years pass by, but we are hoping for the best, yes.
Okay, that's actually good to know, now that people are embracing it. And I like the fact that you didn't leave us hanging. You said, okay, there is a lot to talk about because health is wealth, just like people say. So when we say peptic ulcer, what is it?
Peptic ulcer is what most people call the stomach ulcer.
Okay.
But the name peptic is because of a secretion in the stomach called the pepsin.
Okay.
So we call it a peptic ulcer, sorry.
Okay.
So it happens as a result of a few things, not the usual things we hear on TV and on radio, but those ones are just contributory factors to it. So first of all, there's this germ, I should call it, but it's a normal flora that lives in everybody's stomach lining, what we call the H. pylori, or the scientists will call it Helicobacter pylori.
Okay.
So they just short it to be H. pylori. It lives in everybody's stomach. But then at a point in time when it becomes troublesome, then it starts affecting the system and the stomach, thereby affecting and causing what we call the peptic ulcer, either in the stomach or in the entry of the small intestine, called the duodenum.
Okay.
So these two places are actually where stomach ulcer really occurs most of the time. Sometimes it occurs in the jejunum, that's the lower part of the small intestine, but most often it's in the stomach and then the upper part of the small intestine. But what is ulcer by itself? It is just an open sore or a break in the lining of the stomach. So the stomach has several linings. In science, when we say ulcer, we are just talking about a sore.
Okay.
Yes, so a sore in the stomach. It's just an open sore caused by the H. pylori or oversecretion of the stomach juices or stomach acid. It's become so much in the stomach, then it wears off the layers of the stomach, thereby causing a sore.
In the stomach. Okay. So you mentioned is it a pyloric, right? And you said we have it in every human. So what triggers that thing to start reacting, that then trying to cause this whole ulcer thing?
So it becomes inflamed at a point in time. When we say inflamed, in basic terms, I'll say infected.
Infected, okay.
So it's a normal germ, but at a point in time, it becomes a harmful germ. Now, our stomach by itself produces a lot of acid.
Okay.
We learned in normal science, we have acid, the pH, acid and bases. So the stomach has an acid, it's about 1 to 1.5.
Okay.
And then it has another one, that's a base, that neutralizes the action of the acid. But most of us take all these purgatives that are amamine kind of thing in our stomach. So after you have removed all the amamine, then the stomach doesn't have the strength to stand the acid anymore.
Okay.
So then you have taken away most of the protective layer, and then the H. pylori will work on the lining of the stomach because the acid has become so strong to that stage where the stomach cannot carry anymore. So then it causes the sore in the stomach. And then as the stomach by itself in nature is supposed to store food, and then the juices in there gets it to digest the food. So when it is passing through the stomach into the duodenum, because there's so much acid and it has weathered that place, so it causes pain there as well. So it's either in the stomach or at the entry of the small intestine because of the things we are doing by ourselves.
That's crazy and a little interesting. Right. So talking about the soul, right? When you do or take the purgative and then the whole my thing comes out, or the flames, when they are out and then it happens like that in the tummy, does it develop ulcer automatically, or if you are lucky there will be the sore, but eventually maybe if you are eating well, following the right diet and what have you, it heals?
So a lot of people have developed stomach ulcer several times in their lives, but have healed naturally. You get it?
Right.
But in some cases, it aggravates because of certain things that come into play again. You understand? So after the mucosal lining, so this is not phlegm, this is mucus. Okay. So as the mucosal lining is destroyed at this time, some people keep taking it. Hey, me no, then they keep taking it. Then alcohol comes in there, then smoking comes in there. Then we are taking all what we call the NSAIDs, the non-steroidal anti-inflammatory drugs. Right. For example, aspirin. For example, yes. Diclo.
Aspirin for the
one they put in water, soluble.
It's a painkiller. It's a painkiller. The aspirin
for
painkiller.
The migraine.
For the migraine, yes.
You're alive.
So a lot of us take a lot of painkillers that is really not good for us. Okay. You understand? Right. So those painkillers we take, the painful part is OTC, over the counter. So most of us go with a painkiller, then they'll give you the Diclo, they'll give you the aspirin, they'll give you the brufen. But these painkillers also aggravate the whole condition. So you realize that somebody takes the painkiller will be like, okay, so I feel a pain around the chest bone to my belly button area. Some get this pain so severe that it wakes them up at night. They will say they have abdominal pain, yes, but it's stomach ulcer.
Okay, now still talking about, you mentioned that some people get the ulcer and heal naturally. It's quite strange because I have conversations with people and I'm like, Charlie, we get ulcer because sometimes when some food drops into your tummy, the way it reacts, to the extent that I even get heartburns, severe, like so bad. So with the ulcer healing by itself, what are some of the things? Maybe I just want to know the activity or things that goes in there that makes it heal naturally on its own.
God created the system, most parts of our body systems to heal naturally.
Okay.
So as time goes on, it may heal naturally. But in this case, you're not eating well. You allow your stomach to go hungry for a very long time. Okay. So there's already the ulcer in there, but you are not eating on time. I advise all the time, and I'm a corporate myself, to take breakfast, because you have fasted for like throughout the night and then to the morning, and you not eat and eat around afternoon. So it's like that's like a whole day fast. So then the acidic nature of your stomach is still working. And the funny part is, you know what your stomach does when you imagine or you think about somebody eating, then your stomach is producing the acid in preparation for food to come in. Okay. Or you're taking in a lot of acidic stuff. So I'm hungry, but I see pineapple, and then I'm chewing it. Or you're chewing gum whilst you're hungry. As you're chewing, your brain is planned in that state.
I like the way you're looking at JK. It's a corporate.
So as your brain is wired in such a way that as it's chewing, there's supposed to be food coming down to me, but in this time it's not food, you're only chewing gum, so there's more acid being produced by your stomach just in wait for food to come in there for it to digest. So if it is not coming, then the acid keeps growing and keeps wearing off the layers of the stomach or whichever part of the stomach it finds itself. So it will heal naturally. But if you're not taking good care of yourself, you're taking all the painkillers we've spoken about, you're drinking alcohol on an empty stomach, you're smoking on an empty stomach, and you're not eating your breakfast like a king or queen, we always say. And then you're eating all those acidic foods. There's acid in there, and you're topping it up with acid when you've not eaten anything that will balance it. Of course, there's a base that balances the acid, but how strong or how much of it is there, you understand? So
Okay.
it is up to you.
And now that you've mentioned gum, right? Is chewing gum good?
So in science, actually, what we're thought is that it's supposed to, one, some people have facial disorders, so the gum was created for them to correct the facial, and then some of us have maybe mouth odor issues, so we are trying to correct it. If eating something that is going to change the
Smell.
so you're chewing gum, but chewing it over and over is not good. Some of the symptoms of ulcer is bloating, nausea, vomiting, and then you feel full when you've not eaten. Yes,
Okay.
and then the pain. So most people realize that when they chew gum, most of the times they get bloated.
Bloated, okay.
Yes. So we advise that, yes, when the sweetener is done, the sweet inside
take
the
it
gum
out.
is done.
Just
You
throw it
just
away.
So
like
what
don't-
about you chew, after chewing gum, you feel hungry? It means you
Yes.
don't have ulcer.
Like I said earlier, your brain has told your stomach that she's chewing.
Okay.
So there's food incoming.
Incoming, okay.
So your stomach will be hungry because it's waiting for food to come. So it is for you to eat,
Okay.
at that time, because acid is being produced in wait for food so that it will digest and break the food down. But in this case that you have chewed the gum, your mind has told the stomach that food is coming. Food never came. And it will wear the stomach lining and cause problems.
Okay.
Oh, interesting.
Now let's address some common notions, right? I hear people say that stress causes ulcer. People say spicy foods. People say if you are starving yourself. But you are the expert. What exactly? Like, especially with these three things that I've mentioned, because they are the common ones that we hear all the time.
So there's an existing condition. You already have the ulcer. So stress, the spicy food, and all those things only come to aggravate the condition. They are not the reason why you have
Okay.
the condition, but it's already there. I told you earlier that most people have had it and healed naturally, had and healed naturally. Like, let's not forget this one. As you're healing, you're scarring your stomach. You're scarring the stomach lining. So a lot of people even know they have ulcer or they've had ulcer before. When it becomes severe at a point in time, that's the only time they know they have it. So all those stress, some people say coffee, some people say spicy food, just comes to aggravate it. But it doesn't, it's really not the reason why or the cause.
Okay. So
And then one more thing. You know Nugel O, right? I know someone who takes Nugel O often. Not because a doctor has prescribed it for him, but because I think it started when, like you said, over the counter. So you go there and you're like, oh, today maybe the heartburns
Yeah,
JK
heartburns,
mentioned.
yeah.
And then because and maybe I know that now, okay, when I'm getting heartburns and I take Nugel, I'll be fine.
good, yeah.
Or maybe when I've eaten and I feel like, okay, my tummy is heavy or something, when I take Nugel, after a while I'll get relieved. So it has become sort of a thing. Is it good?
It's not. So it is right that you eat the right amount of food for your stomach. Let's not overeat. And then know yourself. You know that your stomach takes time to digest food, so you eat slowly and gently. You understand? But taking medications that is not prescribed is wrong. Now, over the counter was given to you because of something. Now it is done. Why are you going back? You understand?
Right.
A time will come when you will need the Nugel O and you will take it and work because you have abused it for the wrong reasons. There are other medications that you can use to counter the effect of nausea or bloating or whatsoever. But Nugel O has the O component, which you call the omeprazole, which is, you don't have to abuse. Like, that's the best way I can say. You don't have to really abuse them. So I advise that people take medications that are actually prescribed. And once in a while, I always say, go to the hospital and get checked. Yeah.
that's the fear behind it. Now, I think when we talk about ulcer, we can never go away with, is it gastritis? Gastritis, and also duodenal ulcer, or whatever they call it. But we just want to know the difference, because people, some people complain they take flour food and all those heavy stuff. Then this gastritis thing comes in and the duodenal. I just want us to know the
Lots
difference.
of people have issues.
A lot of people have issues.
Yeah.
So gastritis is actually inflammation of the stomach.
Okay.
So we say gastric, we are referring to the stomach.
The stomach.
Itis is inflammation of the stomach. So it's just like infection, just an infection of the wound in the stomach. That's gastritis, basically. And then duodenal ulcer, like I said in the beginning, the duodenum is just the entry of the small intestine. So this is how that place comes into play. So if the stomach lining is not worn off, but it happens that the acid comes so much to that part of the stomach, the opening part of the small line, the tiny small intestines. When it gets there, then it wears that duodenum. That's when we call that place duodenal ulcer. But I've made it clear that it is not the food that is causing it. The food is rather aggravating the cause. It's aggravating the root cause or the condition itself. But the main causes of these things are those painkillers we have overtaken, or the H. pylori bacteria in the stomach, or we pegging ourselves and reading the stomach of all the mucus, yes, and then taking in all those things that increases the acid in our stomach. But it's not the food, it is an existing condition, because most people have stomach ulcer. I don't really know they have it, because it's healed and back and forth. Yes.
Now let's talk about weight gain. We have a lot of people who have this high gain of weight, and they are being advised sometimes to fast and all that. Don't you think these people are at risk of getting ulcer?
So they are not told to fast completely. They are told to control their diet. So some people will tell you that I am told to eat twice a day. We are telling you to take high fiber diets. So those high fiber diets, even though digest very fast, takes time for you to feel hungry. So if they are not telling you to fast completely, because yes, how do you, if you fast completely, you run hypo, you faint, because the sugar stores in there may run out one day and then you pass out. So taking high fiber diets, cut out the fizzy drinks and all those things, so that you don't gain a lot of weight. Now, in some cases in stomach ulcer, people gain weight because some of the pain reduces when the person eats. So the person keeps eating. And in some cases, especially in the duodenal ulcer situation, when the person eats, after some time there is pain. Because when the stomach digests the food and the food falls into the small intestine, then the pain starts. So the person doesn't eat at all, because I don't want to eat to feel the pain. And in the other case too, I want to eat so that the pain stops. So there's a weight gain in some case, and then there's a weight loss in the other case. Yes.
Okay. Now I want us to touch more on heartburns, because it's something that happens frequently. And me personally, when it happens like that, I have to get my chilled stuff. Sometimes with my cubes and water, just to keep the whole thing calm. Is it naturally that when you are having, or when you're experiencing heartburns, it means there's ulcer, or probably it's a natural something, probably you are allergic to something, that is why you're reacting or getting this heartburns? We want to get that clear.
So how often does the heartburn occur? You understand? So if it's become a continuous thing throughout the day, you haven't done anything. So most of us eat and we sit with the food. So you're supposed to walk around so that it gives your body the room to exercise. Or you're done eating and you're lying down. So when you lie down, the gastric fluid tends to come up here. That's what's causing the heartburns. Because the acid substance is coming up there. The stomach content is coming up there. Sorry. That's how come that is going to happen. But if that's all these ones are ruled out, but you realize that if I eat, for example, beans, I get bloated, then the heartburn starts. Let's go to the hospital. Let's speak with the doctor. Let's take tests to confirm it's not stomach ulcer before we even take any medications at all. Let's get the right treatment for the condition so that it doesn't cause any other complications, because there are several complications with stomach ulcer. For example, some people, excuse me to say, poop out blood because the wound has become so big, so that there's loss of blood. So realize that somebody is anemic, but we don't know where the blood is going to. The person is taking medications like blood tonic and all those things, and the person is still anemic. It's because blood is going out from somewhere. And we don't know. So we check their stool and then other things and realize that there's blood in the stool. So blood is leaking in the stool. Then we see that, yes.
Okay. And I hear people say ulcer of the heart. Is there anything like that?
So I said earlier that ulcer is just
That's
a sore.
Okay.
So in science, ulcer is just a sore, like an open sore. So if somebody has been told that ulcer of the heart, it means that a person has a sore in the heart. So there's foot ulcer.
Okay.
Because there's sore on the foot. Bruley ulcer because sore caused by, yes.
Okay. That's also understandable. And you know, usually too, when, in most cases, when you develop an illness or a sickness, it usually brings other health complications if you are not careful. Does it happen with ulcer too?
Yeah.
Okay.
And some are life-threatening. So like I was telling JK about the complication of the person losing blood.
Yeah.
Yes. So it happens that the person is running anemic. It's because there's blood loss in there somewhere. So when we take the test, we realize that so it's the open sore that is leaking blood is the person's stool. Then it becomes black, or there's blood stain in the stool. And in some people too, they eat it because of a lot of scars. It has healed, and then come back, healed, come back. So there are a lot of scars in there, thereby blocking the tunnel of the stomach. So that it happens that when you eat, instead of the food going down, it doesn't go down. So there's a blockade in the stomach. So the person it has to chew up the food because the food is not going. Yes, so you have to chew up. And then gastritis, like you said, yes. And then there are other cancers that come as a result of stomach ulcer.
And what is the typical treatment like when you visit the healthcare professionals?
So when we realize that it's a normal one, we usually take what we call the H. pylori test. The common one in Ghana is using the stool. We take a sample of your stool to find the bacteria in your stool. But in some places, we call the breath test. You blow air into, yes. And then when it's done, you realize that there's so much acid in there. And then they pick that prognosis. Then we do another one called the endoscopy. It's taking a picture of the stomach lining. So we find all those sores in there. It goes through just the upper part of your stomach. And then we realize that, okay, so there's a scar, there's a sore, and all those things in there. So first of all, we'll give you just normal antihistamines. I don't want to mention medications because you get people
Someone
running
might,
to the pharmacy too, but because Edina said it on TV. So yes, I try as much as possible to avoid mentioning medications. So they give all those medications, and there are antibiotic combinations that are given to treat it, and then the person is fine. And then we give the antacids, like you mentioned, the Nugel, and then the person is fine. But in severe cases, the person ends up in surgery. Yes. The person has to end up in surgery because, yes, the scarring, like I said, and then there's protrusion, and then in other cases, because of the blood and other things. So we have to suture the wound, like so. Suture it in layman terms, yes, to heal it. So we have medications that treat, they are just mild and simple medications that we use to treat it, or you go into surgery, or antibiotic combinations to cure it, yes.
Surgery sounds scary all the time.
Yeah. Now let's even talk about milk. You know, it's something we can never do away with. Anytime you haven't had meds, they go like, oh, no milk. Yes, say. That's how true is that?
But you know, they tell you to drink milk, and they don't consider the fact that some people are lactose intolerant. Yes. So they tell you to take milk. What kind of milk? So it's good, yes, walk to the pharmacy or to the doctor and take an antacid too. Because what if you finish taking the milk? Some people get bloating after the milk, and then they tend to start, they get diarrhea right after it. Then you're going to cause another problem for the individual. So we take just mild antacids to calm it down. Or just take in a lot of water, and then it will calm it down. Just sit calm, and then everything will be fine.
Okay. Now, I really want to touch on some foods we have commonly with the gobe. There are some people, when they even take gari, palm oil, granite, and all these things. When it happens that way, that you're having this heartburn, feeling very uneasy in the tummy, are you supposed to desist or stay away from the food because it's a favorite? The waches and all these things.
So you realize that a combination of the palm oil in the gari is what is causing the heartburn.
Okay.
So can we control it so that you don't go through that pain?
Okay.
Because I say that it's an existing thing. It's not the food that's aggravating it. But if this is what is going to cause heartburns, then you have to control it. Either rule it out or cut it down. So it's either you're avoiding the combination of your gari and the palm nut oil, or you're just taking it without it. Maybe your beans without it, or beans with just the oil without the gari, or just the gari with the beans. Just find a combination that works for you. Or when you're done eating, get a mild fruit, like a banana, soft, and eat it. So dry foods tend to give people a lot of that heartburn. Yes. So when you're done taking it, just get something soft, like a banana, like a melon, and then take it down, and then relax. You'll be fine.
Okay, now let's talk about infants, babies as well, right? It looks like we are paying more attention to the adults. But do fresh babies, or let me say these infants, also experience, have you had cases where we have ulcer in kids?
Yes. And it is sad. So babies experiencing stomach ulcer is sad because baby cannot tell you where the pain is actually. So it takes time. So most of the cardinal sign that we actually look at most of the time is the baby throwing up when food enters.
Okay.
Food enters and baby chews up. Food enters, baby chews up, and baby is so uneasy. Then we take all those tests to find out what is actually happening. Now, so babies, or actually, let's say infants, yes. So it happens that our mothers or new mothers do not know when the baby is hungry, or baby is not eating because baby may not like the food we are feeding it, but we keep giving the baby what we think is okay. Because my friend says she's been giving the baby potato whatever, so I also want to give the baby mashed potatoes. But if the baby is not enjoying the mashed potatoes, you get me? So most of the mothers end up, this is what I want you to eat, and you have to eat it. And then we end up hurting the babies, yes. Because I said earlier that the H. pylori lives in the stomach. So the very moment it becomes inflamed by some germ or whatsoever, then it becomes an issue to the individual. So we plead with the mothers that they we speak that feed the child on request. Or we've been told that 4 hours to 6 and 8 hours, give the baby something to eat. So there are biscuits you give to the baby, give the baby some fluids to be eaten. Don't force what you want the baby to eat.
Okay, now let's go back to the smoking, the alcohol, and what have you, since it's also a part of mankind. During the healing process, does alcohol and this smoking worsen it, or there's a way that also helps?
It worsens it. Actually makes it very bad, and you may bleed. So we advise that if you've not started, I keep saying, if you've not started, don't start. And in a case when you've been diagnosed with stomach ulcer, then it means that you are being told to stop it, because there's scar in there, there's a wound in there, and you keep aggravating it with the alcohol. So you either rule it out completely or stop it completely, so that you don't go into surgery. That's the best we can say. So I don't go into surgery where we'll have to go and suture the wound or anything, because it may gape open, a crow. So if you're taking in anything that will aggravate it will open more, and it's going to cause life. There are cases where food leaks out of the stomach into wrong places because of so the wound has opened so bad that the banku you swallowed doesn't go through the stomach tunnel, but it falls into your abdomen. It's gone to where it's not supposed to be, so you have to rush into surgery to take it out. You get it? So don't do the alcohol and smoking at all, especially when you're diagnosed of it.
Okay. And is reoccurrence also possible?
Very. It's very possible. So lifestyle changes.
Even
like
after
I said.
like surgery?
Yes. Wow. It's possible. So lifestyle, you just have to tailor your lifestyle that you don't go back to the condition anymore. So like we said, I told JK, the bananas, the watermelons and all those things. So, okay, I know I'm not supposed to starve. So just be getting those fruits and be eating them. Like I said, those acidic ones will aggravate the already existing condition. So you only take them when you have eaten something. So I've taken a bowl of fufu, a bowl of banku, then I can eat my pineapple or my very sour orange. But your banana, your watermelon can all pour. Not the very ripe ones though. You'll be fine.
Okay, like the hard ones. Okay, yesterday I saw one. I wanted to buy one.
Yeah.
I didn't buy. So
But,
shame on
yeah.
me. But a quick one.
Okay.
Why do you think ulcer is one of the common sicknesses or illness in, should I say, no, I don't think it's a Ghanaian thing, right? So across or worldwide.
So, like I said, everyone has the H. pylori.
Okay.
So, by chance, it will get infected. That's why it's most common. And then it's common for those of us who come to work at dawn and leave late at night to equally starve ourselves and just be popping things into our stomach. And then you see that there's pineapple on the kitchen table and then you put it in your mouth. And then we are just putting all of anything in there. And then there's a company party. You've not eaten since morning and then you see alcohol and you want to taste it and other things, yes.
Okay.
So it makes it more common because of the H. pylori. It's a normal flora in everybody's tummy. Yeah.
All right. So I want to find out, as normal humans, how many times should we eat in a day?
So your breakfast should be, you should eat like a king or a queen.